Well, our continued COVID-19 fight, a major issue raised in Parliament today as well, with MPs filing 14 vaccination-related questions.
Senior Minister of State for Health Janil Puthucheary said residents below 45 years old will start receiving invitations to book their slots for vaccination from June, if all goes as planned.
People under the age of 45 have also been patiently waiting for their turn. Based on the current schedule, we plan to begin inviting them in June to book their slots. If all goes well, we will complete the vaccination program as scheduled by the end of the year.
Dr. Janil also said that as at April the 3rd, more than 468,000 people have completed the full vaccination regimen.
To date, around 60% of eligible seniors aged 70 and above and close to 70% of those aged 60 to 69 have received the vaccination or booked their appointments. Close to 500,000 residents aged 45 to 59 have registered for their vaccinations so far.
We're encouraged by this strong response. Those who have registered will progressively receive invitations through SMS to make their appointments for their vaccination. This may take some time given the number of people who have registered. To date, about 17% of eligible individuals have received the vaccination or booked their appointments, and we expect the rest should receive the SMS by the middle of May, and they can expect a booking slot by early June.
And elaborating on our passport plan, Dr. Janil said the government and international counterparts are discussing possible mutual recognition of vaccination certificates.
Responding to questions from the House, he added that these talks are still in the early stages and that the vaccine passport will not influence Singapore's decision to approve specific types of vaccines.
Transport Minister Ong Ye Kung also clarified that vaccine passports are subject to different levels of safety considerations.
As for how many countries we are speaking to, there are many. But let me differentiate this. I actually don't quite like the term vaccination passports. It gives you the impression like we carry a passport, we can go anywhere, It doesn't work like that. I think what happened is every healthcare authority, after vaccination, issue a vaccination certificate that has to be verifiable, tamper-proof. And then we talk to other regions and authorities to mutually recognize our certificates. And after you mutually recognize, then you ask yourself, then so what? Do you therefore, which is a question that Ms. Fumiha asked, therefore you're subject to shorter quarantine, fewer tests, and these are things that we have to discuss. And I think the first criteria when we discuss is that how safe is this region? Actually, if a place is safe, such as Brunei, New Zealand, Australia, even before vaccination, we already allow them in without vaccinations because that place is safe. So that is the first and foremost criteria. Is the place safe? And if it's moderately safe, then we can talk about with vaccinations, how far do we lower the risk and what other relaxation can we accord?